Hi everyone, it's Cherry. I'm going to talk to you real quick tonight about a sample history. This is a great tool and we need to learn how to use it a little more effectively. So this is a tool we're going to use for our medical patients primarily. Now, it's not that we're not going to ask these questions to trauma patients, but when we're talking about medical patients, we need to dig into their history. That's our best tool to assess and come up with a good treatment plan for these patients. So we're going to take the sample history that you might use on a trauma patient and we're going to ramp it up a lot and dig into this nuts and bolts of this so we can be great at taking care of our medical patients. So you all know what sample history consists of. Okay, S is signs and symptoms, A is allergies, M is medications, P is past medical history, or some people say past pertinent medical history, L is last oral intake, E is events leading up to, and we're going to throw a new one in here. We're going to throw in R for risk factors. And we're going to make this be our sampler history. We're going to talk about each of these. Hang on. Okay, so first one is signs and symptoms. Most of this is obtained from your primary assessment. So signs are things that you can see. You can see if your patient's sweaty. You can see if they're pale. You can see if they're unresponsive. Okay? Symptoms are things that your patient has to tell you. Such things as they feel nauseous, or they feel dizzy, or they feel lightheaded, or they just feel like something's wrong. But those are going to come when you look at your patient, when you do your ABCs, and when you get that chief complaint. Okay. Allergies are, it's not really a complicated one. Okay. Are they allergic to any medications? I always ask, if they say they're allergic, what happens when you take it? Because some people, like I had a lady one time that, she might be my mother-in-law, that didn't want to take a diuretic because of the fluid she had on her lungs, which would absolutely change her lifestyle tremendously. And she said she was allergic to it. When I asked her why, what happened when she took it, she said it made her tummy feel off. I don't know, I kind of giggled under my breath because it's like, okay, so your tummy feels off or you can't breathe. Which one is worse? And she wouldn't take it. So we do want to ask about medications, over the counter and prescribed. We want to ask about food allergies and environmental allergies as they apply to your patient. Okay? And then we get into medications, and this one's an interesting one. We want to ask about, I've got to get my little thingy out of the way here. Okay. We want to ask about prescribed medications, of course. A lot of times people will forget to tell you something about their medications. Now, I'm a paramedic. I like to think I'm a halfway decent paramedic, but I went to the doctor recently and he asked me, do you have any medical issues? And I'm like, nope, pretty healthy. Okay. Other than the fact that I was there because I had a pinched sciatic nerve, but I'm like, other than that, I'm fine. So as he went down through the history and the medical questions for the assessment, he said, do you take any medications? And I said, nope, just Prilosec. And he said, I thought you didn't have any medical conditions. And I felt like a complete idiot. Now, as a paramedic, I know these questions. I know what they're going to ask, and I failed the test. So cut your patients a little bit of slack. We're going to ask some of these questions a couple different times or in a couple different ways so we make sure we get all the information that we need. Okay, so prescribed medications, over-the-counter medications, And that's kind of where my Prilosec fell in. It's like I didn't get it from a pharmacy. I got it from the grocery store. So I didn't really count it as a medication. Okay, so all those over-the-counter meds. And then we want to ask specifically about erectile dysfunction drugs. Okay, and we're going to ask about those because they are going to have a drastic effect on our nitroglycerin. Okay, and what happens here, I'll tell you just a little about erectile dysfunction meds. So the first one that came out was Viagra. Now the company that makes Viagra did not make it as an erectile dysfunction drug. It was created to be a cardiac medication. And it does exactly what they wanted it to do as a cardiac medication. Now, part of the trials for medications is that they develop the med, they do some laboratory testing, they do some testing on rats and mice and animals, and then before they can put it out to the public, they have to do a human trial. So they get people to volunteer for these trials, and they give them the medication, tell them how to take it, and then track the results. Well, when they went to get the results back after they had done the clinical trials of Viagra, they got a lot of gentlemen that made comments about how improved their sex life was after they had taken Viagra. Well, at that point, there were no drugs that addressed erectile dysfunction. And so the makers of Viagra very quickly said, I think we might have a gold mine here. And they did. So same medication, but they marketed it as an erectile dysfunction drug, and they made a ton of money. Now, people will not frequently tell you that they take erectile dysfunction drugs. Currently, there's 3 of them on the market. Cialis, Levitra, and Viagra. They don't take those drugs every day. It's not something they take morning and night or every night. So they forget about them. B, they probably don't think it's any of your business. And C, it rarely has anything to do with why we're treating the patient. So sometimes they forget to tell you or don't tell you about those erectile dysfunction medications. Now, the reason those meds work so well is because they dilate the vessels in the peripheries or the extremities, okay? All of them. So that increases the blood flow to the nerves and the muscles in our extremities. So in males, that includes the penis, and causes the nerves and the muscles to be able to function better because they have better blood flow. If we give a patient nitro dilates or makes the vessels centrally bigger. So if I've got a patient that's got Levitra on board, and that lasts up to 48 hours. Cialis, I think, lasts up to 72 hours. I think it's Levitra that lasts longer. Anyway, one lasts 72 hours. If they've got that on board and I give them nitro, they've already got dilated peripheral vessels, which is going to lower their blood pressure. If I give them Viagra or nitro, in addition to the Viagra, the Cialis, or the Levitra, we're going to dilate all of their vessels. And I may drop their blood pressure to the point that I can't get it back. Now, once I give nitro, I can't suck it back out. It's there for the duration. So I need to ask about that. You'd like to say, well, okay, so I'll ask my older male patients about that. That's good. But ask your younger male patients too, because there's a lot of younger males that take it thinking it's going to enhance their sexual performance. And once they've taken it for a period of time, they don't function so well without it. Okay? So young men as well. And females. We must ask females because some women take their husband's Viagra thinking it's going to make their sex life better too. And some women take Cialis as a cardiac medication, but it has the same effect. So make sure that we ask specifically about those 3 drugs. Okay? The other thing we're going to ask about is recreational drugs. Now, people that take recreational drugs will likely tell you that they do if you ask them. And I just tell them, I'm not the cops. I'm not judging you. I just need to know what you have on board, what your history is, so I don't give you a medication that kills you. I tell them the same thing about erectile dysfunction meds. I'm like, I just need to know. Because if I give you nitroglycerin, it could drop your blood pressure and it could kill you. And when you put it to them very bluntly like that, they're pretty honest with you most of the time. Okay? So recreational drugs and medication is always something we want to know about. And the last one that I kind of have fun with is herbal medications. Okay, there's lots of them out there, and they have lots of functions. So here's a few of them. Okay, now let me tell you about them. So sage, flaxseed, cranberry, chamomile. I mean, chamomile is something we have in tea that kind of makes us cozy and warm at night. And green tea, which is supposed to be awesome and healthy always. All of those things can interact with some of our cardiac meds and cause internal bleeding. Some of our patients that we're going to take care of think that if it's an herbal medication, it's got to be healthy because it's herbal and it's natural. Well, most of our prescription meds are made out of plants too, which makes them herbal and natural. And some of them are really, really dangerous, just like some of the herbal medications that are sold over the counter. Now, most people that take these herbal medications don't really know very much about what they do. They assume they're safe because they can buy them at Walmart or at the health store. But they do interact with things. They are a medication. They do interact with prescription medications. So we've got to be careful. And we, as EMTs, have to ask about them. Okay? I've gone to houses and they say, well, yeah, I take some herbal medications. I'm like, what are they? They're like, well, they're in the 2 cupboards next to the sink. And literally, both cupboards are full of herbal medications. I'm sure they have no idea what all of them do. So another one, ginkgo biloba. I can't talk tonight. Ginkgo biloba. Okay, a lot of people take this for memory. That is supposed to help you remember and build your memory. But if you take it with fish oil, or with ibuprofen, aspirin, or naproxen, all of those medications are sold over the counter. But they're also all blood thinners. And if you start taking those together, you're going to increase the risk of bleeding both internally and externally. Okay, so they're not without risk. Another one, St. John's wort. You see that a lot. A lot of people take it. It's to stabilize your moods. That's why people mostly take St. John's wort. So if you're depressed, it's supposed to make you happier, and if you're anxious, it's supposed to sort of mellow you out just a little bit. But if you're taking an antiviral medication, it's going to interact with that. If you're taking an oral contraceptive, like a birth control pill, it's going to interact with that. It'll interact with your blood thinners, your cardiac medication, digoxin, and it's also going to interact with your benzodiazepines, which is your medications that control seizures. So that's kind of a biggie. It interacts with a lot. Another one that I find very interesting is horny goat weed. Now, you chuckle at that, or at least I did, and it does exactly what you think it might do. It works just like Viagra. So if you take horny goat weed, and then I turn around as an EMT and give you Viagra or give you nitroglycerin, I may cause some real serious blood pressure issues with you. So ask about those herbal meds. There's a ton that we're not going to know about, but make sure you take a list and start trying to find out what's going on with this patient. Next thing is your past pertinent history, and some things I like to ask. I've had students and they look at their simulated patient or their real patient in clinical setting and say, what's your past pertinent history? Well, the patients look back and go, I'm sorry, what? Okay, so ask this in a way that they're going to be able to give you a good answer. So I don't ask about past pertinent history. I ask questions like, are you currently under the doctor's care for any condition? Okay. I ask them things like, have you had any surgeries? Have you had any hospitalizations? Okay. Do you currently have any medical concerns or medical issues? Okay. And so I don't really care if they had their tonsils out when they were 4, if she's now 85 and having chest pain. So by asking specific questions like that, I can kind of cater where I'm going to go. Otherwise, sometimes you get the full gambit of, you get the whole story, all 80 years of it. Last oral intake. Now, a lot of people say, well, this really doesn't matter to us in EMS. It kind of does. It kind of does. It's going to matter a lot if this patient goes to surgery. But it could matter in our treatment. So, if my patient, if I ask you, when was the last time you ate or drank anything, and they really haven't had anything to eat in 4 or 5 days, that might explain some of the signs and symptoms they're seeing. Okay? Or if they really haven't been able to keep anything down in 3 days, they're going to be dehydrated. I would like to know that. Okay? I would also like to know if they ate or drank, what was it? Because if what they had to drink was a case of Budweiser, I want to know that. That's going to cause issues that drinking a case of water would not cause, okay? And the other thing I ask about is energy drinks, because those are really showing to have some profound and, I don't want to say, detrimental effects on people. Even really young people, really healthy people are having some serious cardiac and stroke issues. Like it raises the chance of them having a stroke or a cardiac issue, specifically a heart failure, by like 400%. So ask about those energy drinks. Some people are much more sensitive to them than others. And then events leading up to. What were you doing? Sometimes why were you doing it? And when did the symptoms appear in that process? So, and the reason I ask this is sometimes it's like you have a patient that is walking across the floor and falls and breaks their hip. Sometimes you have a patient that breaks their hip, it snaps, and then they fall. And we may not be able to know the difference between these, but take a situation where you've got a gentleman who has driven off the road and crashed his car. Did he have a stroke and then that caused the crash? Did he have the crash and that caused a head injury, and that's why he's got the unequal pupils and less responsiveness? Do you have a patient that's in a traumatic cardiac arrest, or do you have a patient that went into cardiac arrest and then crashed? So if we can ask those questions, get a little better picture, we know better how to treat our patient. Okay? And then the last one is the risk factors. And this is huge when we talk to our medical patients, okay? We're going to ask things like, do you smoke? If so, how many packs per day and how many years? I'm going to ask that to every patient that's short of breath and every patient that's having chest pain. Okay. I also want to ask about their diet. Do they eat a pretty healthy diet or not so much? And dig into that depending on what answers you get. Okay. I also want to ask about drug and alcohol use. Now, I'm not going to be judgmental, but I want to know, again, are you using recreational drugs? Do you take prescribed medications? Do you take them as they're prescribed? I have a good friend who takes prescribed medication. She takes a lot of them. She's a wounded vet. She's got a traumatic brain injury. She's damaged her back. She's broke her back in 4 places and suffers from extreme PTSD. She takes a lot of meds for that stuff. Well, it's real easy to get overboard on the narcotics. And she recently had a major surgery. They put her on narcotics for pain, and boom, she's off and running and taking way, way, way more narcotics than she should be. And her favorite is opioids. And so ask those questions. Don't be afraid to dig a little bit. Okay? Alcohol. If they drink alcohol, most people that drink and have a drinking problem will tell you that they drink. That's a good time for you to say, how many drinks per day would you say? How many mixed drinks or how many beers per day? If we don't specifically say mixed drinks, we'll say, how many drinks a day do you have? And they'll answer us in how many fifths a day do you drink? So be specific. Exercise. This is kind of pointed at me, do they? Do they get out and exercise? Do they go outside? Do they walk? Do they run? What do they do for exercise? And how many times a week do they do it? And then the last one is family history. Specifically with medical conditions, this is a big indicator for us. Heart disease and heart attacks tend to run in families. Diabetes tends to run in families. And even strokes tends to be a little bit family oriented. So ask about their family history. If I've got a patient that's having chest pain, he's 35 years old, I'm concerned, but I am a whole lot more concerned if his dad and his brother died early of a heart attack before the age of 40. That changes everything. So ask about that family history, get some good information on that. Okay, that's the R. So our sampler history is simply a conversation that happens, but it leads to really great treatment decisions. If you don't spend a little bit of time having that conversation with your patient, you're very likely going to miss something and maybe pick the wrong treatment. So, take good care of your patients, have a great night, and stay rocking.